Welcome, everybody, to the Consolidate Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I'm here with the one and only Dr. Ivan Zak. Ivan is the CEO of Galaxy Vets, and he does a lot of things. He wears a lot of hats. He's a practicing emergency vet. He's a genuinely, deeply interesting guy. This is a sprawling conversation about, it starts off talking about compensation and production-based compensation and the impacts it has on wellness in vet medicine. And then we get into lots of different aspects of how vet medicine works and what are the underlying issues that we see with burnout. And is vet medicine really worse about burnout than other industries? And it all kind of goes from there. And so anyway, it is a really good, fun discussion, a lot to think about. I thoroughly enjoyed having Ivan on the podcast. Gang, I hope you're going to enjoy this. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Ivan Zak. Thanks for being here.
Hey, and nice to be here. Thanks for having me.
Man, I am so psyched that you're here. First of all, I thoroughly enjoy talking with you. You are just an interesting guy. You're doing a ton of stuff. For those who do not know you, you are the CEO of Galaxy Vets. You were the creator of SmartFlow. You are a co-host of the Veterinary Innovation podcast. You just do a lot. You're practicing, you do some emergency work. Like you're still in practice. You got your hands in it. Like you're just a genuinely interesting guy doing a lot of stuff. And so I was really happy to have you on because I saw something that you wrote on VEN. It was on the VEN news service.
Yep.
And I, first of all, just stop and shout out to the VEN news service. I love that team. They do great work, and they just put out really interesting stuff. So if you're not reading VEN news, you're missing out. But anyway, you wrote an article called "Does Production Pay Undermine Veterinary Team Well-Being?" And this was something that I saw it immediately. It spoke to me because I think this is fascinating. So we talk a lot about compensation of veterinarians on this podcast, and and kind of how we, how the business of vet medicine happens. And so production-based compensation is really common in our industry. And I actually just got an email from a veterinarian who's not paid on pro-sal or production-based compensation, and they were like, "I feel like I should be. Do you agree?" And I thought, oh man, this is production-based compensation has become fairly ubiquitous in our industry, and I've always had some questions about it. And let me be open and say, I get paid on production when I work in the practice, and I don't seem to have problems with it, things like that. But I've always been a little wary of being like, yeah, paying doctors on production is the answer. It does not have drawbacks. It's the way we should go. And so I saw your article and it really spoke to me. Let me just pause here for a second and say, why don't you, if you don't mind, kind of lay out your philosophy here as you start talking about production-based compensation as it interacts with team well-being?
Yeah, so the topic is fairly long kind of standing with me too, because I, as a practicing veterinarian, I actually worked only my first year out of vet school on production. Okay. Because I saw the numbers. They kind of, they said you could be on salary, you could be on production. So, and then they showed me numbers in 3 months, and you would be an idiot not to start on production because I was making better money.
Sure.
And then the first year out, I think I was making more than anybody in my class because I jumped right into Emerge. So that was good. But then because you're an emergency, and because I realized that when people are yelling in your face that you're doing it only for money, then I was like, what if I was not and I can prove it? And then since then, after the first year, never worked on production. So I had my own, thinking about it. And it's just an opinion. And you put 3 vets in the room, you'll get 4 opinions as usual. So so we tried to test that. I wanted to see, actually, statistically, can we survey? And the 3rd year in a row, we're doing this study where we're measuring the burnout. And what we do in parallel with that, we give it a color. And we say, okay, well, what does burnout correlate? So one thing we do, we measure how burnout the industry is based on a sample size, usually about 2,000 people. And then with it, we had certain hypotheses that we throw in every year into a study. For example, what does compensation method do to burnout? What does the age do? What does the experience? What is the gender? And things that we want to know to better understand who's the biggest risk, and then how can we manage hospitals, people, and everything to have less burnout. So that was the intent with which we studied it. And I wanted to prove myself right or wrong in my own hypothesis that production is evil. So that was kind of how we started.
Okay. That's you were a bit more to the point than I was, but yeah. All right. So the null hypothesis is production is evil. All right. Talk to me a little bit about, before we get into this, talk to me a little bit more about the burnout study, because I have been watching this for years. I read it whenever it comes out. I've not talked to you about it in the past, but I have always watched it, and I've always appreciated that you do it. It seems like good work. You do get a pretty good sample size. It's across, different roles in the vet profession, things like that. Talk to me about where your interest in burnout sort of came from, and just, yeah, start to tell me the story of the previous years leading up to this one, if you don't mind.
Yeah, so I got exposed to it through my personal experience. So, and I'm fairly comfortable talking about it right now. But I personally almost lost my life through a suicide attempt, and essentially I didn't know that. Now I know about myself back then, and I just thought I hate my life.
Yeah.
Now I understand that more than myself, people hate life, and a lot of them are veterinarians. So there was, I'm comfortable because I think that we should talk about these things, especially if we get through it and then we're trying to analyze it. So when I pivoted in my career, we built SmartFlow. I love our profession. And at the time when it happened, I hated it. So then when I had a choice in what am I going to do next, and I was going through this, I was going through MBA, and I chose as my thesis for the dissertation to research burnout, because I wanted to find out, is it systematic? Is it actually a problem in the industry? And if it is there a solution for it? And I wasn't looking for a solution in medical or mental or anything like that. I was thinking that there's probably a management problem to it. I think we're driving people insane. And then is there something that we can do better by managing people and prevent burnout through that? You should do yoga, you should meditate, you should work in flow that we talked about before recording, all of those things, but can we manage people better? So I made it sort of my career choice now in the next, hopefully 5-10 years, to focus on understanding how can we manage organizations better to prevent burnout. And that's why this study became the research portion of my dissertation. And I've been repeating it since then. This is the third year that we came up with it.
Yeah, so first of all, I love that. I think you're spot on. When I talk about burnout and preventing burnout, to me, I don't like when I hear this idea that self-care is the answer to burnout, because what you're doing then is you're acting like the person, the individual on the floor in the clinic, like they have the power to take care of themselves. And there's no obligation of the practice that they're in to not burn their people out. And I go, look, let's be honest. It's a division of labor here. It's one, I have responsibility to take care of myself and to, rest and recharge. And my practice has a responsibility to not throw me to the wolves every day and push and not let me take breaks or make me feel bad for taking breaks and things like that. And so I think about it in two levels. There's the individual level and there's the practice level when we start talking about this. So I've always, like I said, I've always enjoyed that that you do this. I also, I 100% with you on sort of telling the stories of burnout and depression and things like that. It's just, I went through a period of burnout. It's been about 4 years ago, and I burned out pretty bad. And the thing that bothered me the most at the time was that I didn't know anyone who had really burned out and then come back and seemed to be having a good time later on. And I felt like kind of the end for me. And so I'm like, I did it. I would not recommend it. If you're like, I'm thinking about burning out, I'd be like, you should do yoga instead. You should go on a vacation, do something else, pick something different. But if you do decide to burn out, just know that you can work through it. And honestly, you can have the best days ever on the other side. And so anyway, I love that you did that. Let's start to talk about your findings on compensation in well-being. So will you sort of break that down for me?
Yeah, so the hypothesis, so every research, our first research that we've done for my actual dissertation was we wanted just to measure it and then understand, is it? Because I thought maybe it's like a shark attack, someone is killed by a shark and everybody's like, oh my God. But no, truly we're burnout. We determined it in the first year, but then in parallel, we just ask random questions like, what's your age? What's your gender? Do you work in corporate setting? Because I thought that corporate is evil, so therefore they probably burn out people more. Turned out that it's actually not true.
Okay, I believe that, yeah.
Yeah, so that was kind of proven wrong, and then we thought, oh, cool. So we have a standard measurement of burnout. There's a standard thing that we use. It's called professional fulfillment, and it's just 16 questions, but it gives you this temperature gauge. And then in parallel, we'll throw in sort of questions that will read the stats and say, okay, people that are over 40, they are less burned out than those that are under 40. And then, women are more burnout than men. And then, so there's things that we started to look for. Last year, I was interested is goal setting in your career and life affecting your burnout status, which it does if you don't have goal setting. And this year, I was wondering, okay, the evil production that I thought it was, is it actually evil in terms of burnout? Does it contribute to burnout? And that was one of the 3 things that we tested this year. And we've proven myself almost wrong. So essentially it was the reverse, which was shocking to me because there's multiple studies in human health where it clearly says that production actually does cause burnout. So that's an interesting finding.
All right. So talk to me about this. So what you're saying is in the studies that you're doing, you found that production was anti-burnout related. Do you feel like being salaried is more likely to lead to a path to burnout? Tell me about that.
So not necessarily in that direct correlation. It wasn't like, oh, stop being on salary and you're fine. Like it's not, you can't apply it as a treatment.
Gotcha.
But the point is that what we found out, people that have less financial security and certainty in the future are more burnout, which is kind of logical, but we wanted statistically to prove that. Mm-hmm. But then the second comparison of data showed that people that are on commission feel like they have better financial security. So it was not a direct, but it was an inference through this sort of, people that are on commission or production, they feel like they're more secure in their financial future or retirement planning. And it turned out that those people are less burned out. So it didn't show that it directly causes the burnout, which I was surprised. And I kind of proven my 20-year hypothesis being wrong, but that's why you do the research, to prove yourself wrong.
No, that makes sense to me. Hey guys, I just want to let you know real quick, I got something really big coming down the pipes that is super fun. It's not a workshop, it's not a webinar, it's not a live event, it's not a summit, it's not a program. It is something that is just going to be a ton of fun. And some of you have already found the path to learn more about it. I'm not going to tell you what it is here. I'm just going to tell you it's great and it's coming. And if you want to look around a little bit, you might be able to find the path to learn more. And so some of you already have, some of you have not. If you're like, I don't know what he's talking about. If you, I don't know, if you like puzzles, if you like trivia, trying to figure things out, find the root of questions, it might be worth kind of poking around drandyroark.com. Definitely the newsletters. If you get the newsletters, there's fun stuff there. But if you like figuring things out, it might be time just to poke around a little bit. We got some fun stuff going on. That's all I'm going to say. I'm just going to leave you with that. Guys, as you were, enjoy the rest of the podcast. I'll have some more news for you sometime soon. So I like this a lot. Do you think the idea basically is that if you're paid on production, then you feel like you have more control of your situation? Is that, as you kind of summarize it that way?
I think that's one of those things. But if I correlate it to burnout, because burnout has a lot of people, when they talk about burnout, they really imagine it's like working too much. I work in a facility right now. I do a couple shifts a week in ER for fun, and I have clear understanding that people are burned out in it, but they don't have a full workload. This hospital is not loaded enough with the patients. It's a new startup. And they have all other things that organizations can do wrong to actually cause the burnout, such as there's lack of control. They feel like they're top-down managed. There's complete disconnects of values. So that's the second one. These are kind of defined in 1986 by Christina Maslach, who researched burnout in organizational behavior. So these are the actual triggers. So lack of control, conflict of values, insufficient reward, not only in monetary, because they actually compensated well, but not enough thank you and just basic gratitude. Unfairness, favoritism, people on the same sort of level getting different pay rate with no explanation, and community breakdown, which means that we don't know how to give feedback to each other and we don't know how to resolve conflict, which is systemic. So it's not about working too much, it's about other things that can happen with it. So I think that when we talk about people on compensation or not compensation, I think we need to look at the big picture of how people are working. Because let's say I'm on production and it
Mhm.
seems like I'll have less burnout. But what I'm doing, I'm driving the entire team crazy and I'm just go, 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 go because I am chasing the dollar. I want
Sure.
to be productive. But what do techs get per hour while I'm burning them out? And they're actually more burnout than vets usually. So I'm actually creating the environment in which techs, assistants, and receptionists are running like crazy without compensating more. So the question of compensation of the organization is bigger than just one individual as a vet, but how do you compensate the team and align the incentives so everybody is rowing in the same direction?
Is it possible to see that? Is it possible to look at the support staff who work with doctors paid on compensation versus support staff who work with salaried doctors?
So we are trying this. So we just launched it 2 months, actually 2 quarters ago, and we launched this, and it's very interesting. So there's a book called Great Game of Business. It's the whole methodology, and what they recommend is creating this bonus structure in which essentially what vets don't do as business people. They don't set the budget. That's just corporations do that. Individual vets, they never say, this is my budget. Because when we hear budget, we always think that budget is how much I can spend. This is
Sure.
not in the budget. You can't buy an extra chair. You can't buy another anesthetic monitor, whatever it is. But also budget is how much I'm planning to earn. So what we've done in our bonus design, we said, okay, our plan, and we're reporting to investors, is to be in this budget. You need to hit this number in June, this number is July, this number in August. If we all, as a team, hit the number above that, anything in surplus will be split between the teams as a bonus. So
Okay.
bonus is not in January, here's Christmas bonus for no reason. It's not a gift.
Mm-hmm.
It's a reward with a very clearly articulated goal. So essentially, I think, and this is my new hypothesis, is that this way, if the doctor's on the production, driving the team and driving everybody, but then the team knows if they help this doctor to produce and they hit it above the budget that we clearly identified for them. We show it actually in the app. We have an app that all our employees have. They know how much they make per day in the clinic. It's open book management, and they're trying to hit it above the waterline that we set. And if they do, in the end of the quarter, each quarter, they get a little check that represents the bonus.
Yeah, I like it. That I always like it. So I'm a big fan of positive reinforcement, and like you said, giving positive reinforcement when it's a clear link to the behavior that we're reinforcing, and you're like, this is what it is, and this is what you did, and this is when you were successful, and here's how we're how you're being rewarded. That's always spoken to me. Talk to me a little bit more about we have a problem with feedback and conflict resolution. You said that's systemic. What do you mean when you say that?
Well, we had a really interesting conversation today in our podcast about in general how we communicate in veterinary domain. So I can't quote the study, and I know that it kind of floated through my desk one day, but apparently vet industry is the lowest EQ that you can find profession. We just people that want to work with animals and not talk to people. That's like everybody says that. And then we're just not trained through either we're in tech school, whether we're trained for animal attendant or veterinarian. There's very little on how to talk to each other. There's how to talk to clients. There's how to, articulate diagnosis in more simple terms. It's there in the schools. There's never how do you become a leader, how you become a communicator, how do you provide and take, which is very important, feedback, and then how do you resolve the conflict? So I think that those are the huge, huge deficiencies. And whenever we go into a new team, so, when we acquire practice, we go in and we understand, do people know that? And it's just a baseline. It's the basic training where you type people. I hate saying it like that, where you're typing people, but you do the disc. You understand what they are so you can communicate with each other and understand that a person like me would never talk to someone analytical and solve something on the spot. They'll need a day to think about it. And then also, how do you resolve things? How do you don't become passive aggressive? How do you, like, all of these things? I think we just don't have it. It's just not in the curriculum wherever we come from. So, and I think it is pretty chronic in the industry.
No, that does make some sense. If you had your magic wand, and so you're looking at this and you're looking at the data, and not just this year's wellness study, but previous year's wellness studies, and we're talking about feedback and we're talking about, resolving conflict and things. How do you fix this profession in the next 5 years? You got magic wand power. You could make some changes. What would you do?
That's a Yeah, that's a good question. That's $1 million question, multi-million-dollar question.
Well, sure.
I think if you let people solve their problems at the place where they work themselves, that's the main thing. Stop being a manager who decides for the people that do the job how to do their job. If you can just give them the autonomy to decide that I have a problem X, but you need to give them power and say, you are responsible and accountable. And then that leads to the compensation through the proper compensation structure that by fixing these problems and becoming more productive and efficient, your reward at the end as the business owner or just someone who receives bonuses is there as well. I think if we can allow all of our people, techs, vets, solve things, and the management would just support and create a system of idea generation and putting them into practice, I think that would be the best way.
I have this theory that veterinary medicine, I don't have a survey to back it up, but I have this theory that veterinary medicine, I think we're disproportionately perfectionistic. I think that there is a perfectionistic tendency in veterinary medicine. I think there's a lot of people who want to get things right. I think we select for that tendency in veterinary schools and our education and things like that. And my thesis goes, if you buy into the idea that veterinary medicine as a whole is more perfectionist than other industries, I think that this is the number one reason that we struggle to delegate effectively, is because there's a right way to do it and we know what the answer is and we want to give the answer. And in order to delegate effectively and empower people, just like you're saying, Ivan, I'm a huge believer in this, take people the problem and let them come up with their own solution. But I feel like people struggle so much to do that because they want to say, this is the answer, now do the answer. And it's hard to get traction. Do you buy into any of that? Do you buy into the perfectionistic part? Do you think that that's a barrier to letting people be empowered to fix problems on the ground?
100%. And I think that this is a huge part of our burnout problem because it's almost like, we're in the veterinary podcast. So it's almost like we're breeding and selecting the breed with a certain traits for intelligence, solution orientation, everything else. But in parallel, we get this perfection. And perfectionism actually is not a good thing. People that are proud and saying, I'm perfectionist, this is actually it's a form of fear. You're afraid to make a mistake. So you really need, like, if you look at it from that angle and thinking that you're proud of being perfectionist, that's not a good thing. That means that you're afraid to make a mistake and try something new. So I think that you're absolutely right. We're selecting people with certain traits, and it drags behind it the burnout, people that are more susceptible to it, and all other things.
No, I love that you say that way. It's funny, the paradox that I kind of put together is our selection criteria is very much pro-perfectionism, right? Because you take that test by yourself. There is no delegating. It is you yourself. Self-improvement is painful because you're both the hammer and the chisel, or you're both the stone and the chisel. And it's sort of the same thing as people who excel in the academic part and get into vet school and do well in vet school are often that driven perfectionistic personality. But then if you want to become a high performing veterinarian, you want to build a really good, positive workplace that's antithetical to that sort of mentality. It has to be the doctors that really perform there are a little bit more loosey-goosey. They're a little more willing to let other people do things and kind of say, the team is excited about this. It's not exactly what I would do, but I think it's positive. I think my idea is better, but it's not the one they're excited about. So I'm just gonna go along and be supportive of them. I think that that's sort of like one of the weird pain points that we have is what gets you a degree is not necessarily what's going to make you happy and maximally successful, afterwards. So anyway, Ivan, thanks so much for being here. Thanks so much for talking with me. You've got a lot of irons in the fire. Do you want to talk real quickly about where people can find you? Where can they learn more about Galaxy Vets? Where can they hear the Veterinary Innovation Podcast? Tell me about all you got going on, where people can keep up with you.
Yeah, well, thanks for inviting me first, and then that was a great conversation. I do recommend subscribing to Veterinary Innovation Podcast, which you can find at veterinariinnovationpodcast.com. There's a great conversation always about innovation, so sign up for that. That's a cool one as well. And then Galaxy Vets is just the project we're trying to implement all of these anti-burnout practices and management. So all the research that we do, it's incorporated into building this organization that is owned by veterinarians and employee ownership is incorporated into it. So, and that one is at galaxyvets.com. So either one, you can find us there or on LinkedIn if you can spell my full last name, but I'm not going to do it here.
I'll put links in the show notes to all that stuff, guys. I'm going to link to The Great Game of Business, the book that Ivan mentioned earlier. So I'll put a link to that in the show notes. Guys, thanks so much for being here. Thanks for listening. Take care of yourselves, everybody. I'll see you later.
Thanks, Andy.
And that's what I got for you guys. I hope you enjoyed it. Thanks to Dr. Ivan Zak for being here. Man, he was great. I'm going to have him back on the podcast. I just really enjoyed this conversation. I think I'd like to talk to him more often. So anyway, I thought it was super fun. I love these idea type conversations. I hope you guys enjoyed them as well. If you did, do me a favor and write me an honest review wherever you get your podcast. Share the podcast with your friends. That's a really nice thing that you can do. Anyway, guys, take care of yourselves. Be well. Talk to you later. Bye.